So this was in collaboration between me and Professor Eric Johnson at the University of Wisconsin-Madison bacteriology. So the topic of this talk is a microfluidic sensor for botulinum neurotoxin, or BoNT, type A, using the hydrogel incorporating Snap-25. Here's the outline of the talk. After motivation, I'll introduce the principle of our detection and show our experimental fabrication and experimental results. We'll also give the conclusion and provide a vision for future work. Motivation. Perhaps you're not familiar with it, but in fact, Clostridium Botulinum Neurotoxin is the most lethal substance known to human being. It presents a severe potential biological toxin, bioterrorism danger, and the lethal dose for this is about 1 microgram per kilogram for body weight. So essentially, 1 gram of botulinum neurotoxin can kill or permanently paralyze 1 million people. So that we can understand that this presents a very severe bioterrorism danger, but at the same time, more severe is relatively easy to access it. There are formal channels. For those of you who are very familiar with cosmetic surgical field, Botox is actually botulinum. It's just a very diluted version of this toxin. And at the same time, it's fairly trivial to make homemade and ultimately get in the black market for the botulinum neurotoxin, because the manufacturing involves very non-sophisticated methods. In fact, back in early 2000s, the Shrinkyo is a religious cult, a fraction of the religious cult. They tried in Japan to release this toxin at the U.S. military base. Fortunately, they were not successful. This toxin is very hard to detect because it's colorless, tasteless, and at the same time, it requires a very low dose, lethal dose to kill a person. And human natural sense cannot detect it at all. The current detection method involves very expensive and time-consuming approaches. There are main 2 ways to do it right now. One is through the mouse assay. This one obviously requires very highly skilled personnel, and it kills thousands of mice for 1 detection, for 1 confirmation. It's obviously very low, has very low efficiency. The turnaround time is between 7 days to 2 weeks, because you need to send a sample to nationwide centralized centers for the detection. Throughout the United States, there are about 20 of them only. The second approach is ELISA. The previous speaker talked briefly about the ELISA. ELISA is a very sophisticated amplification system. It requires a very high amount of reagent and it costs a lot. Our goal is to have achieve a low-cost, easy-to-implement passive sensor for the food industry throughout the whole, from the production to the sale. So it's the whole supply chain. And for that, we need low-cost sensors. We need to be able to perform in-field test, and we have to make sure the whole procedure is easily handled by non-specialized person. So here's our basic approach. We're taking advantage of microfluidics. So the basic idea is that on the substrate, we're going to pattern some polymer structure, polymer materials. We use hydrogel as the base, as the matrix. And in that, we're going to incorporate the proteins that can be specifically responsive to the botulinum neurotoxin. So when the sample comes in, if the sample contains the toxin, what it does is that it will degrade the hydrogel structure, so it becomes a very easily visualized effect. If the sample cannot degrade the hydrogel, then we can be very confident that the sample is safe. And we can satisfy the requirements for low cost because it involves microfluidics. And the polymer materials. So these are all materials and the fabrication approaches that requires relatively low-cost procedures. And because we're targeting a passive sensor, which means that it doesn't require specific, sophisticated instrument for the readout. And the handling obviously is going to be easy because the sampling, basically you suck the sample and provide it into the chip, and you can get the readout out. Here's the principle of the sensing event. The idea is we're going to have a hydrogel as the matrix materials, and within it we'll have the cross-linkers. These cross-linkers will hold the hydrogel matrix together. At the same time, the cross-linkers will have special sections of the peptides that can be specifically responsive to the BoNT. And when the BoNT, the toxin is present, what it does is that they're going to cleave these sites on the cross-linkers so that the whole matrix is going to collapse. And once the whole matrix collapses, the hydrogel will become soluble and it can be easily detected. So to sum up, basically, we're going to take advantage of the peptides that can be specifically cleaved by the BoNTs. In this case, we're using where our target detection is botulinum neurotoxin type A, and the specific corresponding substrate is Snap-25. And the key of this idea is that we're going to take advantage of the biomolecular enzyme-based amplifying event. So we do not need any electronic amplifier amplification anymore, but we're taking advantage of the enzyme amplifying event. So a very small amount of toxin can cleave a large amount of hydrogel, so we can realize very high specificity and sensitivity. So this idea has been implemented before. This is the work from my colleague and collaborator. The biomolecular process is a very touchy and tricky one. For instance, in this, the idea of having the cross-linker, everything works, but unfortunately, it creates a false alarm. What happens is that at the end of the cross-linker, the peptide, they used cysteine, and the cysteine has disulfide bonds in it. Well, the problem with in detection of the bond, you have to use DTT to cleave the toxin to separate into the light chain and the heavy chain, so that the DTT is actually going to present it. Unfortunately, DTT also attacks the cysteine, cleaving the disulfide bond within the cysteine. So that ultimately creates a false alarm. So our idea is twofold. One, we want to eliminate that false alarm, and second, we want to implement this into a microfluidic device, so that is more devicey and more implementable in the real applications. So the first part of our contribution is the synthesis of the cross-linker, and it's a key modification of the Snap-25 peptide. So it's basically here, the 17-mer is where the response is going to happen. The cleavage is going to happen. Instead of having the cysteine at both ends, we're going to use the lysine, as you can see here with the K. And of course, it sounds very trivial, but in reality, it's hard. The reason why we chose lysine is because it also provides the necessary bonds for us for the three-dimensional cross-linking during the process. So with that, we can eliminate the potential false alarm created by the usage of the cysteine. At the same time, we kept the enough amount of the bonding site for the cross-linker to work. Remember, we need the cross-linker to grab the whole matrix together. So here's the biochemistry that we developed for this purpose. Here's a very brief description of the process flow for patterning the hydrogel. So it's very typical microfluidic fabrication with the glass slides of the substrate. We first use isobornyl acrylamide. This is a soft material as the mold, and then we put PDMS onto it, cure it, peel off. Then we get the PDMS substrate, and then we bond onto it another PDMS so that we create all these cavities. This is how the microchannels are formed, and then within the microchannels, we have another UV exposure step to pattern the hydrogel microstructures. In this case, we're using hydrogel microposts. So that is the fabrication, and this is how the device is going to look like. It's a fairly simple device at this moment. The inlet, outlet, and the microchannel, and the hydrogel microstructures are defined within the channels. And this is the close-up microscopic optical image under the microscope of the patterned hydrogel micropoles. And then we perform the conceptual test. So in this case, we're using a different kind of hydrogel to show that our idea actually works. So we're using a different matrix. The matrix is a PAAM hydrogel. And these hydrogel are connected with the cysteine. So as you can see here, you use a cysteine, so it can be responsive to DDT. So DDT will attack these the cysteines and ultimately will make this gel substrate collapse, which is exactly what happened. So it's basically we have DDT over here. Initially, we have a certain structure, and this is hydrogel, and we mixed it with the carbon powder so that we have a clear dark color, high contrast with the substrate. And then with the presence of the DDT, the hydrogel collapse and the carbon powder starts to spread away. And then we have our BoNT responsive hydrogel. And we first test this activity. So it's a very typical standard way of the testing of the bioactivity. We use trypsin. The reason for using trypsin is that trypsin has many cleavage site that can attack different sites of the snap. So it will be very fast, and it should be able to attack the hydrogel in relatively low sensitivity. So that's why we chose trypsin to do the test first. As you can see here. With the buffer, nothing changed after 4 hours, but with the trypsin after 4 hours, the hydrogel is pretty much gone. So we confirm the idea of the bioactivity of our gel. Now we're going to use the BoNT this is the real thing. So here, these graphs are showing what actually happens in the channel. We define all these hydrogel poles. They're exactly the same. And at the very beginning, they're the same. And then we have the BoNT, light chain, and then in the herpes buffer and the DDT, these two serve as the control. As we can see here, after 38 hours, the BoNT gel has been cleaved, has been compromised, folded up, and starts to degrade. And in the herpes buffer, pretty much nothing changed. And here's the key for the removal of the false alarm. As you can see here on the DDT, we're using very high concentrations. As you can see here, it's 30 millimole. And after 38 hours, the same amount of time, the hydrogel was kept intact, which means that we did remove the false alarm that was present in the previous similar work. Now here's some more detail in terms of the cleavage. So as we see right here, if you look at it very carefully, unfortunately this gel is very transparent. You have to look very carefully to observe the effect. As you can see here, with the attack of the BoNT A of the hydrogel, you can see some pasty material starts to seep out of the original ring that confines the size of the gel. This is consistent with our idea of after the cross-linker being cleaved, the hydrogel will collapse as the matrix material starts to spread out. That's why the pasty material starts to show up outside of the original ring. As the comparison, in the controlled experiment with buffer only, the hydrogel structure doesn't change much. So in conclusion, we have developed a prototype microfluidic device for detection of botulinum neurotoxin type A. It was based on the responsive hydrogel, and the response of the device is on the hundreds of nanomole level at this moment. And we confirmed that it functions, and it's cleaved by it can detect the BoNT A, and it also avoided the potential false alarm that was present in previous work. In the future, we will try to miniaturize the hydrogel structures, further miniaturize it, so that we can improve the sensitivity and significantly reduce the response time. At this moment, the response time is on the range of tens of hours. It's not so bad because our idea is to use it as a passive sensor to be put in a food package. But if we can improve the response time, we can potentially use this as a kit that can be used in labs as well. And we are also exploring this idea to apply it into other detection of other toxin that is based on the protease. Essentially, protease is that this protein can attack and compromise other proteins. So this idea should work with other type of protease-based toxins as well. With that, I conclude my talk, and we thank the National Center for Food Protection and Defense and the University of Minnesota for the funding of this work, and the people who have helped us providing the technical assistance as well as the technical discussion. Thank you very much.
We have time only for a very quick question.
This one, the response time is dependent on the biomolecular process. So at this moment, it's about 20 hours, about 10 to 30 hours, depending on the concentration of the toxin %. What we're trying to do right now is to significantly reduce the size of the hydrogel structures so that we can improve the response times. Our latest results, we can get it to about a few hours, and we're keep pushing the envelope at this moment. Thank you.
Okay, thank you.